Good morning. If you have decided to start to become a professional hypnotherapist, keep watching our training videos about hypnosis. Hypnosis is a powerful technique with which you can help and improve the quality of life of a great number of your future patients. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis. And in addition, you will be able to download several ebooks also free. Let's see in detail the regressive therapy. Regressive therapy is a technique of access to the unconscious used for more than 3,000 years by many cultures. The therapy consists of searching for information from the past, stored in the patient's unconscious, finding and reviving the origins of their unhealthy roots, which are the cause of their current problems. This allows the patient to increase their self-awareness, access their inner wisdom, improve their relationship with others, discover their creativity, and access their true potential to be able to design their own life. Now, we look for the possible cause of his disorder. In that past life, we try also to find out if in that life there is someone of his current life, and if it has to do with the problem or disorder suffers at the moment. We must leave everything settled to treat the disorder that suffers in his current life. That is to say, if you have something pending, something you had to do and could not do, forgive someone, etc. If, for example, you have a panic of water, a phobia of water, we will try to find out if in another life something happened to you with water. For example, if you drowned or had a bad experience, etc. Once we find out the cause, we have to leave it closed and let him return to his current life, totally free of that fear, that burden, that sorrow, whatever it is. It is about closing and settling the question. If in that previous life, no, we find the cause, we will go back to another previous life. We must find a way to break any script from a past life that interferes with the script of the patient's present life. We must be creative in bringing closure and closure to any unfinished business. The patient has to return to their present life without any ballast from their past life. It is important to emphasize that what happened in that past life belongs to that past life and not to his current life. Your current life is a new life, and you have to live without ballast. We settle any problem and we return him free of any burden, so that he can live his current life in an enriching way and grow as a person, a human being. In the same way that we return you free of all burdens, we can also return you with something positive from your previous life. For example, in a previous life he could have been a great pianist. In his present life he is also a musician and plays the piano very well. Let's look at an example. Now you are going to return to your current life. You are going to return taking with you a spark of genius, or what you were in this previous life, without forgetting what you are now in your current life. Now you will play the piano much better than before. Now you have that spark from your previous life, more of experience of your current life. Now you have mastered the art of playing the piano much more. We will take advantage of the positive aspects of their previous life, if we think it is appropriate and if it serves to alleviate their disorder. Of course, we will leave the negative and we will return it leaving behind, everything closed, settled, and without any kind of ballast. In regression, the patient has to see and understand the traumatic events as learning, so that a crisis suffered in a past life becomes an opportunity for knowledge, cleansing and reinforcement of one's potential, and not as a ballast to carry into one's present life. Therefore, we perform past life regressions to cleanse or deactivate the emotional blocks and beliefs generated from painful situations, and replace them with positive mental and emotional structures. The patient returns with a more expanded consciousness. That is to say, when he comes out of the hypnotic trance, we give him the order that he is going to remember everything said in the session, thus becoming aware of his past life or lives. Now he has more knowledge and more information about himself, as he recovers information about his past lives. By doing regressions, the patient is more aware of the depth of his own being. His mind expands, and other potentials such as intuition, understanding, and empathy for others become more evident. The patient is more aware that within himself he will find the knowledge he needs. Normally, by becoming more aware of what one is and what one was, the mind expands. The anguish, anxiety, and fears disappear, and self-confidence returns. The patient, by knowing himself better and knowing how his deep world conditions his life, allows him to load himself with resources and means to direct all his personal potential towards his psychic-emotional balance, and thus redefine all his internal objectives. Feeling accepted and loved by oneself is the greatest source of well-being. The mental body feeds on the thoughts that we generate consciously, and the mind usually works in such an automated way that we are not usually aware of the extent to which we damage ourselves with the thoughts and beliefs we generate when they are very negative. When we generate emotions of anger, resentment, rejection, etc., we become unbalanced and lose our center, our point of tranquility and confidence. The first step is to become aware of how we function in order to begin to generate changes. To do this, we apply regressions, so that the patient has knowledge of himself and the way he functions in this life and in previous lives. If you are interested in learning more about clinical hypnosis, watch our next video, Basic Principles of Regressive Therapy. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis, and you can also download several free ebooks. If you have any questions, add them in the comments area. On this topic and many others we will talk about in the channel and in the video that we will publish. So if you are interested, do not miss our next videos. Thank you very much.